Hey everyone, it's Josie, and welcome back to the Dear Asian Community podcast. Have you ever wondered how sleep affects your health? Well, it is recommended by the National Sleep Foundation and the CDC that adults get 7 or more hours of sleep per night. And yet, another CDC report finds that 35% of adults get insufficient sleep. But what does this mean? Well, sleep actually plays a huge role in your quality of life, more than you might think. Not only is it useful for memory consolidation, but it's key to living a healthy, energetic lifestyle. What many people don't consider is that there is a medical career that focuses on making sure that people get enough sleep, or don't sleep too much. What do these specialists do? How do they treat patients? And is this career more common than you might think? Today, I'm asking these questions to Dr. Eric Ye, a sleep medicine specialist at University Hospitals, to better understand this medical career. Thank you so much for being here with us today, Dr. Ye. Would you just be able to give like a brief introduction of yourself and your career too?
Sure. As Josie said, I'm Eric Ye. I'm currently an attending physician in sleep medicine at University Hospitals. I also have an appointment with Case Western University School of Medicine as an assistant professor. The other hats that I wear are probably less well known, but it's more on the administration side of medicine or hospital administration, if you will.
Mhm.
One of my other title is Director of Clinical Operations and Quality Improvement, and that's in sleep medicine. And the
Mhm.
other one is Provider Informaticist. That is outside of sleep medicine, but sleep medicine is included. I do that for our internal medicine group subspecialties. So that's kind of what I do right now as my current job. Yeah, but journey to it, it's a little bit longer. So I will see how you want to know.
Yeah, for sure. Yeah, thank you so much. That's perfect. And thank you again just for being here. I really hope that we could just help some people out to understand a bit more of your career. So my first question would be, how did you find out about this career and like decide to pursue like maybe medicine in general? What was the process and what really motivated you to do this?
Well, probably unlike most of the people in the world or most of the doctors,
Yeah.
I never wanted to be a doctor.
Oh, really? Oh.
I and I never wanted to pursue medicine as my career, to be 100% honest. And
Hmm.
that's why I really didn't have a sparkling GPA in my college times. Like, I mean, I was exploring college life, just not academically. So,
Yeah.
and
Okay.
and and it was, it to me, it kind of just just came about, really. It's
Right.
you know, I'm a Christian, and then I felt like I touched God in a very real way, when I was 14, but really
Hmm.
decided that I want to follow him more closely when I was 24, 25. And
Hmm.
I had a pretty clear calling from God that I should go to China. And then
Right.
I was
Yeah.
like, yeah, so I just had a simple prayer and simple question and say, how should I go to China? And what do you want me to do over there? And then,
Hmm.
it was a very weird story, but just kind of somehow found out that I have a friend who I knew back in Vancouver where I grew up, and then
Right.
she was attending medical school in China in Beijing University, and I didn't even know that was an option. I
Uh-huh.
never came across my head, and I was like, okay, well, I'm gonna apply. Not a great report card, but happened, and
Hmm.
then well, I got in, so
Oh,
yeah.
perfect. Okay.
Yeah, and then I don't know how that happened, but I got in, and then as a Taiwanese, I guess they were being nice to Taiwanese people in China, political
Mm.
reasons, one way or the other. Just
Hmm.
never thought I would go on that path. And then I did. So I spent 6 years in Beijing. And then my wife and I, at that time, when I graduated in 2014, we decided to move back to the States. That's
Hmm.
when I really started preparing for the licensing exam here in the United States. And that was a painful process, but got through it fine. And then somehow ended up doing family medicine, then sleep medicine. So that's kind of
Oh,
how
okay.
my career went into sleep medicine. As it's not a residency per se, it is a specialty care. So basic training, what I have is in family medicine. Yeah.
Oh, okay, I understand. Wow, okay. That was a lot. That was very inspiring though. I think it's interesting like seeing how like different professions come or different professionals come to like find the career that's perfect for them. Because I know like for me, as a student who's like trying to figure out what she wants to do in the future, like everyone's always like, "Oh, well, what are you good at?" Right? Like, what do you like to do? But it's always
Mhm.
like, "Okay, well, what I like to do isn't always going to be the career that I ended up having for the rest of my life." And so I
Yeah.
think it's like always kind of a trade-off. I think I
Yeah.
realized like when you were describing your process, it's always like kind of give and take a little bit. So yeah, that was very interesting and thank you for sharing that. I think the second question I want to ask is more because I know there's a lot of people who want to do pre-med recently. I think like I don't know if it's recently, there's just been a surge, but like at my university, there's so many people who want to do pre-med. And I had to go to it's like a welcome week like seminar and for pre-health because that's what I declared my track to be. And I saw one of the statistics that was like, oh, 43% of people in the College of Arts and Sciences want to do pre-med. And then that's as a freshman though. And then in senior year, only like 12% of them were like staying and actually finish the pre-med degree. And I think it's kind of been generalized that like pre-med is just like, oh yeah, I want to go to med school. I want to become a doctor, but then it's like they're not sure maybe what type of doctor, like what the path is like. So I think my second question would be, so what was like the actual path? How was the education like medical school or then actually like the sleep medicine specialty?
Okay. So let's walk back a little bit.
Yeah.
My parents being typical Chinese parents, they really wish that one of their child, or if not all of their child, would be doctors.
Yeah.
So my brother opted out, even though he probably could have. And then my sister just didn't do that well in college entrance exam. I mean, relatively not as well. So back in Taiwan, they were gone, and then so their last hope was on me. It was never really that high of a hope, but then
Yeah.
their last hope was on me. So we did have a conversation, me and my dad, just kind of like, I had some requests and he had some requests, and the request was that I will get a certain things, and then and then my response to that will be, I will try my best to go through pre-med and get into medical school after I graduate from college. Well,
Hmm.
that failed after my first semester. Kind of. Well, maybe second semester, I guess,
Right. Okay.
like what I was trying to do. I think, I still remember at University of British Columbia, UBC, that's where I attended my undergrad. And then, there's one class that I took, which is OrCam, and then once I get into OrCam, and then the professor, the first thing said, there's 90% of you want to do medical school. And after this class, 10% of you will proceed and go on. And that
Yeah.
was that was pretty true because I obviously was like, not it, like,
Yeah.
that was not for me. And then, pre-med, a lot of people want to do pre-med. It pays too. Like everybody wants to do pre-med because
Mm.
doctors sounds nice. It's a noble career. I mean, it's decent earning, but if you really want to earn big money, you don't want to go into medicine. I guarantee you, you would do, you'll probably do AI right now, like
Right.
I think
That's true.
there's so many other ways you know, to make wealth, like it's doctor is not, to be 100% honest with you all, like it's not the way to get wealth. It's a good way to help people,
That's
and make a decent living while doing that. So I
Yeah.
think that's what career as a doctor is about.
Yeah.
However, if you feel like, helping people and, making people happy bring you gratitude in your life, then I couldn't think of a better career than being a physician.
Okay.
Or I
Yeah.
guess besides, helping people to find God, I guess that's another one.
Yeah, for
That's really
sure.
also very fulfilling. However, to me, like healing is a big process, and then everybody needs that.
Mhm.
So somehow I got into family medicine because, going through medical education in China is entirely different than what's happening in the United States or
Mhm.
Canada or the
Mhm.
Caribbean or whatever. So I don't think it's easy to compare. So I basically took all the basic knowledge that I obtained from medical school in China, but then have to kind of re-plug it into different scenarios and then ways of thinking by applying those knowledge. Medical education in North America is definitely a lot more application based, which I think it's a lot more resembles a lot more to real life medicine. So anyway, going through the board exam process was hard, like the USMLE process, step one, step two, and step three. But going through that, I actually thought I was always going to be a surgeon, hands down. Like, give me a knife,
Oh,
let me know where to
okay.
cut, give me something to sew up. I was doing that all the time because I just love surgery. It was just cut people open, fix it, and then you're done.
Yeah.
That's kind of my personality. But then when I did a rotation at Boston Children's in the pediatric orthopedic department for a month, I realized that was a month where I woke up and went to work before my daughter, who was 2.5 years old at that time, before she woke up, and I would come home after she went to sleep. And then that was my, reality check moment. Is like, do I want
Hmm.
to do that?
Hmm.
And eventually the answer was obviously no, I don't want to do that,
Yeah.
even though as much as I like surgery. But then my next option will be, okay, what else do I like? I love obstetrics. I love delivering babies.
Mm.
I was like, but I hate gynecology. So,
Mm.
okay. And then you
Okay.
put OBGYN together, that's what I thought it could be. But then
Yeah.
later on, I found out that, oh, family medicine doctors in the US also includes obstetrics if you desire to practice that way. Anyway,
Hmm.
since your question was a long one, I will go into sleep medicine too. That just kind of fell in my lap. Basically, I was in second year residency, almost finished up second year. Never thought about doing specializing because
Yeah.
specializing more for internal medicine people who want to specialize in cardiology, like oncology, hematology, whatever you name it. Family
Hmm.
medicine docs usually just go out and be a primary care doc. That's kind of what they sign up for.
Hmm.
Specializing is not as common at all. But then I found out about sleep medicine. And then, there's a mentor of mine who was the director of sleep medicine at that time at UH. And then I can't remember why I was looking for him but definitely not for career advice. But then he kind of proactively sat me down and talked for 45 minutes, and then I was sold. I feel
Oh,
like, oh, that's good because
yeah.
I get to mix things up with clinical work by actually seeing patients, but also other parts of clinical work, which is reading sleep studies and then finding out
Mm.
what's wrong with people's sleep.
Mhm.
And then be able to use that other side of things, which is not directly patient facing, but it is still clinical work. So I get to mix and match, so I don't have to, you know, um, have the stress of seeing patients every single day. That
Mhm.
could be a little tiring sometimes. You just need to mix things up a little bit. So that's kind of how I feel like, hey, that's a perfect mix. Like
Right.
reading sleep studies is not always like, you need to do it at the certain set time. You can put your kids to sleep and then you have 2 hours at night, 7 o'clock or 8 o'clock to 10 o'clock, and you can do some work. But whereas that will bring you some flexibility if you, let's say, have to volunteer to go on the field trip with your kid in elementary school to the botanical garden. The sound as fun as it may sound. Yeah, but those are the flexibility that I kind of get as a sleep. If
Yeah.
I was just a family medicine doc, I probably won't be able to get that. And that's kind of how I
Oh,
get.
okay.
Yeah, yeah.
I got you. So I just want to like clarify, is like sleep medicine a type of family medicine or are they different?
So that's what we call an added certification. So in family medicine, there are a couple, and there's quite a few, probably about 10 of them, added certification. I'll just mention a few, for example, like geriatrics. Like you can, add on a 1 year fellowship up on top of the 3 year residency to be a geriatrician. Being a
Oh,
geriatrician gets you an
okay.
extra avenue into, let's say, if you want to be a director of a certain nursing home or whatever, which nursing home mostly old people, so therefore geriatric it matches, and you can be
Mhm.
sports medicine. So that's a 1 year added certification. So you can be a family medicine doctor that does a lot of orthopedics work, like joint injections or whatnot. There's addiction medicine, obesity medicine. So those are all added certifications for
Okay.
family medicine. Yeah.
Okay, that makes more sense.
Yeah.
Yeah. Okay, that's cool. So I know you kind of went into it a little bit,
Yeah.
but could you just walk through like a day in the life of being like a doctor? Like what do you do at the clinic? Like how do you treat the patients? I imagine it's a lot of like consulting or
Yeah.
something. Yeah.
Yeah. I think sleep medicine is a part where it's not that much life or death.
Yeah.
And it's really, there isn't really such a thing as true emergency in sleep medicine.
Hmm.
People can argue, but 99.9% of the time it's not true emergency. So,
Okay,
we
yeah.
can be more relaxed in that sense, but relaxed, but not it's so super important because you could probably tell if when you don't sleep well, you feel like crap, and then if you don't sleep well for a long period of time, you feel like life is miserable. So
Mm-hmm.
you will want to get that problem fixed. And then we kind of joke like sleep medicine is slow medicine. Things don't just get changed overnight. Except probably one particular scenario. But so a day in clinic for me is um it typically is a 1 full day clinic. Sometimes I have half day clinic, teaching clinics or whatnot, but my
Mm-hmm.
own clinic per se, a 1 full day clinic, I typically see on my schedule is about 8 patients in the morning, 8 patients in the afternoon. That's my typical schedule, even though right now I almost always see above my typical schedule, probably about 10 patients in the morning, 10 patients in the afternoon,
Wow. Okay.
just because I don't have that many clinic times out there. So, in order to see the patients and follow up with the patients that have already established care with me, I do need to just move around and make it work. So,
Mm-hmm.
there are new patients where I work up, we go through, your basic cheat complaint and then go through their basic sleep schedule, sleep diaries and stuff like that, sleep habits, and then some of what we call review of systems. Sometimes you just ask some of the certain questions, and then when they pick up, yes, 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 then it's like, oh, you actually have this. You just didn't
Mm-hmm.
even know that you have this.
Right.
So that's review of systems is important, and then that comes to our assessment time. Assessment is, we kind of come up with something we call differential diagnosis. You are feeling X, and the reason could be A or B or C or F. We don't know, right? So
Okay.
you kind of think about it, and then you kind of prioritize them in the kind of like a likelihood, right? And then you try
Yeah.
to rule each one out. Sometimes I tell people sleep is sometimes really hard. It's kind of peeling the onions. Something could be
Yeah.
causing your sleep problem. It could be physiologic. Let's say you have obstructive sleep apnea or whatnot. Then, those are anything physiologic or pathophysiologic. It's always easier to me.
Okay.
It's
Yeah.
always easier to treat, because we know what's causing it. So we just get treatment, and just kind of see what happens, and typically 85% of the time it works, but then it could be psychiatric, okay, or it could be psychological, or sometimes it could be even social.
Mm.
By social, you mean, hey, I could be talking to a kid, I could be talking to a parent, and then they live in the place where they hear gunshots all the time at night. What are you
Mm.
gonna do? And that's kind of
Right.
what happens to their sleep.
Yeah.
They're scared. And not because physiologically, psychologically, or psychiatrically that they have any issue. It's just
Uh-huh.
socially they can't. Or they
Oh.
live in an apartment that's 750 square foot with six people. It's
Mm-hmm.
difficult.
Mm-hmm.
So those are the things which you kind of, as a physician, you can say, there's nothing I can do, or you can take a step back and say, okay, what else can I do to help? And my other days, I read sleep studies, and then those are my enjoyable times too. I look at the computer screen and then just kind of looking at those waveforms and, just various different things and just kind of plug myself in to see how the patient is doing when they're sleeping. It's kind of fascinating, actually. Oh, during this stage, they happen, and you see that. And then, it's harder to explain that, when I don't have stuff to show, but
Mm-hmm.
that's another good part of my
Yeah,
week. Usually I
for
spend
sure.
a day doing that too. Yeah.
Okay. Okay, cool. Wow, that was very detailed. Thank you for all this information. I actually
Yeah.
never
Yeah.
thought about like the social aspect of sleeping. I my last question was just a bit like of a curiosity question
Mhm.
I want to ask. So I have some friends that I know they take maybe they have trouble sleeping or like falling asleep on time. So they take like melatonin or
Mhm.
specific things to like help them to fall asleep. Although I did read like some recent research that apparently melatonin is not good, but I don't know, maybe you want to comment on that. My real question is, so how do you help people who maybe are sleeping like too much? Is that a condition that you guys treat or
Oh yeah, absolutely. So
yeah.
two things. If you want to take melatonin, don't take it at bedtime. It's a very poor sleep aid. It's
Oh,
actually
really?
meant to adjust your circadian rhythm. So typically when you
Oh,
take melatonin, take it an hour and a half before your desired bedtime to 2 hours maybe. So if you want to go to sleep at 11, take melatonin at 9 o'clock. But taking melatonin is one small part of the equation. The big
right.
part of the equation happens between 9 to 11. You got to ask yourself, what are you doing between 9 to 11?
Mm-hmm.
Okay, how come when babies were born, they had usually no problem sleeping? But as you
Mm-hmm.
grow, and then elementary school, you also have no problem sleeping, most people. In high
Mm-hmm.
school, you start to have some problems. In college, you start to have more problems. Why? One of
Right.
the most obvious thing that, maybe you and your friends can look at, what's different between then and now, besides the fact that you're older, okay?
Yeah.
You also have something called a cell phone, right? Now,
Yeah.
okay, whoa, that's a big thing. Kill that phone, okay? Like it's I'm no joke, some of the most easiest turnaround for people, especially with insomnia problems, is that if you want to solve your insomnia problem, first put your phone away and not even putting in your room. And then
Mm-hmm.
everybody's like, but I need that for an alarm. I was like, are you kidding? I can buy it like, you know, analog alarm clock on Amazon and have it
Yeah.
delivered in 2 hours. Okay, so don't BS me on that, right? So people will look at that and just imagine. And then one thing that I tell people is that how many times that you pick up your phone and then you want to go right into a certain app to do a certain thing, and you ended up doing like 5, 6 different things, and you put your phone down
Yes.
and ask yourself,
What
what
was
did
I
I
even doing? Yeah.
what did I pick up my phone for? Right? That's a very obvious example how distracting and how much information is shooting at you, and you have no way to process that. Um, so therefore, that kind of gets in the way when sleep is trying to knock on the door, right? And
Mm.
then when people say, "Hey, can I try to go to sleep at 11 o'clock?" and then I'm swiping my phone until 1, I can't sleep. And then the next thing is you sleep until 9 o'clock in the morning because you don't have classes until the afternoon, or you sleep until 10, you sleep until 11. Well, if you
Mm-hmm.
sleep until 10 or 11, how do you expect your body to be able to fall asleep at midnight? No
Yeah.
way. I mean,
Yeah.
you need a 7 to 9 hours, and then your actual sleep time is actually between 2 a.m. to 10 a.m. So therefore, going to bed and trying to force yourself sleep, it never works. We have a
Mm-hmm.
saying said, "Let sleep come to you. Don't go chase sleep." Right?
Mm.
So,
Mm-hmm.
sleep and eating is the same. You don't try to force yourself to eat. You eat when you're hungry, and you
Yeah.
sleep when you feel sleepy. Why
Yeah.
do you feel like you can control your sleep? when the more you try to control your sleep, the more sleep is saying, see you later. So if you sleep too much, and that depends on how much is too much, you know? So, hey, I sleep 5 hours on my weekdays and then I spend 12 hours sleep on the weekends. Trick me. Well, no, you're just trying, your body's trying to make up, the lack of sleep, So
Mhm.
that's one thing I always tell people, why do you think you sleep too much? You know, is it 7, 8, or 9 hours, or 10, or consistently 11 or 12 hours, And then is it really that much? Because sleep is a matter of perception. For people who actually really sleep too much, there are conditions called narcolepsy or idiopathic hypersomnia. Those are real things with real disorders with problems, and then
Yeah.
there are pathophysiologic issues with these people, and then there are ways to diagnose it, and of course there are ways to treat it also. There are two ways to diagnose it. One of them is requires a lumbar puncture, which we takes a sample of your cerebral spinal fluid, we call it CSF, and then we look for a particular chemical in there is called hypocretin, or AKA orexin. So if for true narcolepsies, their orexin level typically is low. Okay, and then that's diagnostic of narcolepsy. And orexin, what it does really, it's an on and off switch controller in your body. Typically, when it goes to REM sleep, I'm not gonna go into too
Mm.
much technical details here.
Yeah. Okay. Yeah.
But the idiopathic hypersomnia is a different story. Idiopathic hypersomnia patients typically don't have insufficient orexin level. So there's another test that we do, which most of the time we do with this test because, you don't want to just poke into people's spine, whenever. So it's a test that we call MSLT, multiple sleep latency test. I call it a 24-hour sleep test because you come to the sleep lab and you stay overnight and have what we call a diagnostic polysomnogram, PSG. It's just to ensure that you have a good at least 6 to 7 hours of nighttime sleep. If you're insufficient sleep at night, next day, then we won't know how valid that real test is. For
Right.
MSLT is a test where you take 5 different naps, 2 hours apart. Each time you have opportunity to fall asleep and sleep until minute 30. So basically, we'll see how many times you can fall asleep, 5 times in a day. If you're able to fall asleep on average less than 8 minutes out of 5 naps, then that's also diagnostic of at least idiopathic hypersomnia. And
Okay.
during those nap times, you should not be dreaming or you should not be going into what we call REM sleep, rapid eye
Yeah.
movements. And if you have two or more of those nap periods that you fall into what we call, sleep onset REM, then that's also on top of less than 8 minutes of mean sleep latency, then we that's diagnostic of narcolepsy. And then we treat. And then when it comes to treatment, there are probably 4 to 5 different categories of medications that we could use.
Oh,
Uh,
wow. Okay.
yeah,
Yeah.
yeah, yeah. So test is extensive, and then but sometimes, a lot of times actually, once they are treated, they're like, my God, I felt like I was living in dreams my entire life until now. I just
That'd
came
be
out of my
crazy.
dream. I mean, those
Yeah.
are real time, I mean, real life stories and real life patient responses to me. So, if
Okay.
you want me to talk sleep medicine, I could go on for another 2, 3 hours nonstop, like
Yeah. That's
it is a
amazing.
very, very fun field,
Yeah.
So, and then there's a lot of very positive patient stories. And then because when you teach people sleep, you literally change their life. There's so many
Yeah.
people that come in and gives me big hugs,
Oh,
Dr. You
yeah.
changed my life. And sometimes it's not even just them, their partners, their family. They come in, they hug me. It's like, you changed our lives, because
Oh,
you helped fix this guy,
yeah.
So it is very gratifying. So if
Yeah.
you want to be a doctor, be a sleep doctor.
Gotcha. I believe it. I believe it.
Yeah,
It sounds very
yeah,
fun.
yeah, yeah.
Yeah. Well, thank you so much for all of this information. I'm so glad that you were willing to sit down and talk with me a little bit more. And who knew that sleep was so important to our lives?
Yep. You
Yeah.
spend 1/3 of your life doing it.
Oh,
So
yeah. Wow, that's
it
actually crazy. That's a
is
lot.
crazy. It is crazy.
Yeah, I need to work on that. I need to work
Yeah.
on using my phone less.
Limiting your phone. Do
Yeah,
not replace that with an iPad or your laptop, though. You have plenty of
that's
other
true. That's
times
the same.
to
It's
do your
still blue light.
schoolwork. Yeah, I mean,
Yeah,
blue light is one thing, but it really is the content. Phone is the worst because of the
that's
notifications.
true. Yeah.
Your computer not as bad. I mean, you do browse over to other things, from time to time. I'm just speaking from personal experience, right? Because I'm like that too. I am no exempt from, okay, I can just be so focused, right? No, but sometimes we need to do some objective measures to kind of put things
Hmm.
together.
Yeah. Thank you so much.
No problem. My pleasure.